Hello, everyone. My name is Linda, and today I'll be talking about an article from the New York Times entitled Health Insurers Seeking Mergers Play Down Antitrust Concern. This was written by Robert Pear and published on the 22nd of September. So, essentially, in this article, Pear describes the meeting between the Senate Judiciary Subcommittee and chief executives of Aetna and Anthem, which are two of the largest health insurance companies in the country. This past Tuesday, they actually had to defend their potential consolidations with smaller health insurance companies before the subcommittee. Aetna is intending to merge with Humana, and Anthem is intending to merge with Cigna. For reference, under the Clayton Antitrust Act of 1914, the federal government prohibits mergers and acquisitions that could lessen control in the market. Of course, the article goes into depth regarding the merger implications, goes into depth about the merger and its implications. Essentially, the insurance companies during the meeting were arguing that their mergers could actually enhance competition, whereas senators and advocacy groups against the merger were saying that it would, in fact, reduce competition. So, in terms of the policy questions, I had in mind to what extent should healthcare insurance companies participate in consolidations that could offset the balance of power in the market? And to what extent does the federal government play in regulating these businesses, especially keeping the consumer patient in mind, as well as costs and other factors? Hopefully, this is tugging at the idea of healthcare in the framework of social justice versus the framework of market justice. In terms of the impact that this could have on potential stakeholders, I'll be talking about patients as well as insurance companies and providers. I wanted to start off with insurance companies. For one, these insurance companies, particularly Anthem and Aetna, stand to gain a lot. Though they say that they can improve the care and the costs for the individuals and enhance competition between Blue Cross and Blue Shield, who have the largest market share in other states, their expansion of clientele would definitely or could definitely lead to an increase in profits for them. In terms of its impact on other insurance companies outside of these two majorities, the Kaiser Family Foundation actually submitted a report that said that the Aetna and Humana merger could essentially mean that this consolidated firm would provide coverage to over a quarter of Medicare Advantage beneficiaries, making it the largest or the majority insurer for Medicare Advantage clients. Putting into question the concentration of power in the market, especially when it comes to Medicare. Additionally, this also creates barriers for other insurance companies, especially newer ones, looking to expand clientele, as they'll have a hard time competing with such large consolidated firms. In terms of impact on the patients slash consumers, these insurers could increase care by expanding the network of doctors and hospitals offered to these patients. However, these mergers could also impact consumer choice, as these mergers could remove services previously offered to clients. Also, these mergers also drive the question of what would be motivating these larger insurance companies to produce innovative solutions to current and future healthcare challenges, especially when they would hold so much power over costs and control in the market. Lastly, the dominant insurer could force hospitals to cut costs, which could impact the quality of care provided to the patients. Along those same lines, providers could potentially be paid less, which could also impact, what clients that these providers choose to see. But that's all I have for today. Let me know of your comments, questions, or concerns in the discussion box. Thank you for listening.